approximately 17,500 people will develop kidney or bladder cancer per year in the UK.
People from the black community we don't talk about cancer. We see cancer as a death sentence, really.
Cancer in Asian community, I think is seen as a big taboo. So the minute you mention cancer, people think, oh, wow,
Patients are often very embarrassed to come forward. They don't want to tell their friends or relatives or discuss it.
You got to get it diagnosed early on and get it treated. If you ever notice any blood in your urine, go to your GP straight away.
Approximately 17,500 people will develop kidney or bladder cancer per year in the UK.
People from the black community we don't talk about cancer. We see cancer as a death sentence, really.
Cancer in Asian community, I think is seen as a big taboo. So the minute you mention cancer, people think, oh, wow,
Patients are often very embarrassed to come forward. They don't want to tell their friends or relatives or discuss it.
You got to get it diagnosed early on and get it treated. If you ever notice any blood in your urine, go to your GP straight away.
Welcome back to the Ben Breakfast Show, and you were just watching a really important advert that really highlights a very, very, very serious issue that is not often discussed in the Afro-Caribbean community, but we are so esteemed and so privileged to have someone that is going to be talking to us about the blood in pee, and that could be related to cancer, but I'll let him explain even more. Of course, we are joined this morning by our second guest, who is Dr. Jonathan Makanjola. Welcome to the Ben Breakfast Show.
Thank you very much.
Welcome, Doctor.
Thank you.
Welcome. Why don't you tell the viewers a little bit about yourself? What is it you do?
So I'm a urological trainee, specialist registrar, looking after patients with kidney, bladder, prostate cancer, and men's health as well.
Oh.
So why, okay, I've seen this campaign a lot on social media. I was actually going through my Twitter feed this morning, and I saw it on Vox Africa's thing. They retweeted it and they atted me. I don't know why, but they did, So I did look at it and I have some knowledge about it. But can you tell the viewers a little bit about the campaign itself and why it's important, especially for the Afro-Caribbean community?
Okay. So this campaign is funded and headed by NHS England, and it's the Blood in the Pee campaign, or blood in the urine. It's trying to highlight the signs and symptoms of kidney and bladder cancer, which are the 7th and 8th largest cancers in the UK. The reason why we're looking at targeting black and ethnic minorities is that studies have shown that they tend to present later and have more serious signs of disease, and often it can be fatal. And the message really is, if you have blood in your pee, even if it's just the once, you really must get it checked out and go and see your doctor, basically.
Oh, wow. And what are some of the early symptoms before one discovers blood in their pee? What are some of the early symptoms?
In women especially, we see women that have recurrent infections of the bladder infections, and they may just discount it as a cystitis or bladder waterwork infection, and they get multiple antibiotics, and actually the underlying causes are cancer. So the important thing to mention, especially older ladies, is if you have recurrent bladder infections, you must see your GP, because it could be the early signs of kidney cancer or bladder cancer.
Now, I mean, speaking of targeting black and ethnic minority communities with this campaign, what would you say are the early signs? What should we be looking out for? Like, what is abnormal? And what is normal? Because some people think that certain tone or color in their urine, without us kind of getting too graphic this morning or disgusting, is normal. Can you kind of take us through the different shades and what's normal and what's not?
So if we drink a lot of water, our urine is quite clear, and that's good and healthy. And you all know when you don't drink enough, it's quite dark urine, basically.
Okay, yeah.
Keep it at that, any kind of redness, so I call it rosé colour. So if you see a rosé tinge to your urine, to frank bleeding, that's so any shade between that. Sometimes I say to people, Ribena colour as well. Oh, wow. Any kind of bleeding, you must get it checked out. It's not normal to have blood in your urine. We should not have blood in our urine.
And I mean, pardon the air, but if it hurts when you pee, is that a symptom?
Yes, so sometimes it hurts, sometimes it doesn't. Often it's the one when you pee that's painless is more of a worry, because when it hurts, it could be a bladder infection. But despite that, you must get it checked out. I think that's the key critical message. And often people don't check their urine when you pee, you just pee and go. But we're saying to especially women as well, have a look in the pan as well and make sure.
I think I'm one of those that does check, actually.
Is that straight to the A&E, or is that something you have to speak to your GP?
Yeah, A&E is not the place to go. As busy as it is, A&E. You should go and see your GP and have a discussion with them about the signs and symptoms, and then they'll make an appropriate referral, and you'll be seen within 2 weeks in the NHS.
All right,
because it's quite rapid.
Because I'm just imagining some. Some
just a mass stampede down to the A&E.
Oh no, straight out A&E.
Very important to say, A&E is not the place to go. So you go and see your GP, talk to your practice nurse, and then you'll be referred appropriately to see specialists like us in the hospitals for investigations if appropriate.
So let me ask, in terms of this campaign, how are people being taught or being made aware of exactly how they can prevent this, or how they can know about this?
So really, these kind of cancers, bladder and kidney cancer, affects more people over the age of 50.
Okay.
So there are Twitter and website campaigns, but we're also targeting health centres, GPs, media such as this, which is a fantastic way for people to engage with the community. And that's really kind of putting a message out there that if you see blood in your urine, please go and see your GP.
Don't ignore it.
And what are the statistics, doctor, in terms of ethnic minority and Afro-Caribbean minorities?
Studies have shown that there are about 17,000 deaths for diagnosis of kidney and bladder cancer year on year. Yeah, it's quite a lot, big problem. And about 7,000 people die of kidney and bladder cancer a year.
Wow.
Yeah, so it's a big problem.
It is.
Wow,
You know what? And we've spoken about this at length several times. We actually spoke about it last week. Actually, we had a guest on, and I think unfortunately there is this huge misconception that if we go to the doctor or we see certain signs, but we speak about it, it's almost as if we're kind of welcoming that thing, and it's a little bit of superstition mixed with a little bit of culture mixed with a little
social stigma.
Exactly. How can people that are watching at home, should I say, be encouraged to ignore all of that and get checked out?
So I work in a large teaching hospital in South London, very diverse population, and I find the group really at risk is the old African or Caribbean men who just sit on their symptoms till things are dropping off, hanging off. That's when they come to the GP. And I'm always encouraging them, if you see any signs, blood in your urine, please come and see us. And those are the group really we're trying to target specifically because they present a lot later. And unfortunately, when they present too late, the cancer spread and there's very little we can do. If caught early, it's a curable disease, basically. That's the main message.
So what causes it? I know we've spoken about like the symptoms and the cure, but what is the cause?
So, good question. Smoking is by far and away the biggest single cause for bladder cancer and kidney cancer as well. So if you smoke, you're at increased risk of developing this cancer. In African and mainly African populations, there's a condition called schistosomiasis, which is common in West Africa, and these are eggs that lay in the bladder, and they can cause bladder cancer. So in our African population, I always ask about if you've been back to Africa and places like Nigeria, and see if they've been swimming in lakes and things. Often can happen. But really, by far the most important thing is smoking. And also what people do. So if you've worked in printing industry, the chemicals and dyes can affect it. Interesting enough, we've had a lady who worked with her, he's a hairdresser, so hairdressers at increased risk.
Dyes, yeah.
And they work with the older type of dyes in Africa where it's not as regulated. And these people can present with bladder cancer.
Of course. And they don't often wear gloves either.
Exactly.
Yeah.
Exactly.
Yeah.
Wow. So there you go for hairdressers and some of their hairstylists out there. You have to wear gloves just to be on the safe side.
Of course.
And if you see any sort of blood in your urine, please consult your doctor.
Most definitely. Now, for people that are watching and that have seen signs and that do want to go to their doctor or are considering going to their doctor, how can they find out more information so that they can spread the word?
Yeah. So NHS England have a very, very good website, which is very informative. And actually, the video we've been seeing in the adverts, some of our patients who have been successfully treated from the black and ethnic minority give their case reports and talk about their experiences of kidney and bladder cancer. So if you go to www.nhsinglehp.org, nhs.net/blood in pee, and also NHS Choices. We can Google that. There's a lot of information and advice about symptoms and signs and what to do, basically.
All right. What about you in particular? If some of our viewers want to get in touch with you to get more information, how can they get in touch?
I think really going via the NHS website is a really good way. Also going to your GP as well, because your GP then refer you to the appropriate urology specialist in your local hospital.
Okay.
So yeah, that's really the most important way. Otherwise, I'll be inundated.
Exactly. Otherwise, everyone will be like, I want to speak to Dr. Makandjula. I want him.
So your local hospital, your local GP, via your local hospital, and then they'll put you onto the appropriate services. But I can't stress this enough. If you see blood, go to your GP.
Of course. And last but not least, as we round up, why is it that it is this specific time period that the campaign is being put forward?
So traditionally, it's always been in this period of time now.
But why this particular time? Is there a reason why it's been chosen?
I think it works quite well, and I think NHS England's priorities, they have different cancers they work on, and it's a timing issue. But we found traditionally this period has been a very good period after the Christmas period where there's been a lot of uptake from that. So
all right.
It's historical.
Amazing.
Thank you very much, Dr. Makandjula.
I think you've answered all our questions, but thank you so much. And of course, if you viewers at home have any other questions or concerns, the website to visit is right along the screen, just there. It's nhs.uk/blood in pee. Again, nhs.uk/blood in pee. So that will give you all the information that you need. Thank you so much, Dr. Jonathan Makandjula. We really appreciate your time. Thank you so much for coming to speak with our viewers. Thank you very much.
We will go for a quick break, and when we come back, we'll have more from Ben Breakfast Show.
Keywrite, specializing in all aspects of property lettings and management. If you have a property, tenanted or empty, contact Keywrite on 0208 808 5789, where you'll be sure of expertise, competitive pricing and first-class service. Visit www.keywrite.co.uk. Telephone 0208 808 5789. Keywrite, the right key for your property investment.
Approximately 17,500 people will develop kidney or bladder cancer per year in the UK.
People from the black community we don't talk about cancer. We see cancer as a death sentence, really.
Cancer in Asian community, I think is seen as a big taboo. So the minute you mention cancer, people think, oh, wow,
Patients are often very embarrassed to come forward. They don't want to tell their friends or relatives or discuss it.
You got to get it diagnosed early on and get it treated. If you ever notice any blood in your urine, go to your GP straight away.